There is an old saying in traditional medicine, treating a stomach disease is 30% medication and 70% nourishment. If you suffer from stomach issues, you know the struggle. It feels like a cycle that never ends. You treat it, it gets better, and then it comes back. When that familiar pain strikes, we are always stuck with the same dilemma: do I pop a pill, or do I try to fix this with food? The truth is, the answer isn't simply A or B. It depends entirely on what kind of stomach problem you are actually fighting. Welcome back to the channel. Today, we are breaking down the science of stomach health, the pros and cons of meds versus diet, and revealing a powerful third option you might not know about. First, we have to identify the enemy. Stomach disease isn't just one thing, it's a massive family of conditions. It includes everything from chronic superficial gastritis and acid reflux to acute gastroenteritis and stomach ulcers. To give you an idea of the scale, peptic ulcers alone affect about 1% of the entire US population, sending over 54,000 people to the hospital every year just from bleeding. And gastritis? That's even more common, caused by everything from bacteria and medication side effects to autoimmune attacks and stress. So, when are drugs absolutely necessary? If your stomach issue is caused by a bacterial infection or an immune system attack, relying solely on diet is not going to cut it. You need medical intervention. Let's talk about the biggest culprit, H. pylori. About 4.4 billion people worldwide are infected with this bacteria. It is stubborn, hiding deep in your stomach lining and protecting itself from acid. It is a major cause of ulcers and even cancer. Here is the hard truth: no food, not garlic, not honey, not broccoli, has been scientifically proven to kill H. pylori. To clear it, you need a specific combination of antibiotics and acid suppressors. If you only change your diet and skip the meds, the bacteria will just keep destroying your stomach. Then there are conditions like eosinophilic gastroenteritis, which is basically an allergic reaction in your gut. While diet helps you identify the trigger, like milk or wheat, you often need steroid medications to stop the immune system from attacking your own body. And for erosive gastritis or ulcers, we need to stop the self-digestion caused by stomach acid. This is where proton pump inhibitors, PPIs, come in. They are powerful. Studies show they can heal up to 100% of peptic ulcers within 4 weeks by creating a neutral environment for the lining to repair itself. So, does that mean food therapy is useless? Absolutely not. The World Gastroenterology Organization highlights that diet is critical for the long-term health of your gut. While food can't kill bacteria or shut down acid production like a drug, it builds your defense system. First, you need nutrients to repair the damage. Your stomach lining needs high-quality protein, vitamins A and C, and zinc to rebuild cells. Second, you need to reduce irritation. Cutting out alcohol, spicy foods, and fried items gives your stomach a break. And third, fiber from sources like oats and beans ferments in the gut, creating good fatty acids that promote overall health. However, food therapy has a major limitation: it is slow. It works for maintenance and prevention, but it cannot replace emergency treatment during an active flare-up. So, we have the speed of medicine and the safety of food. But what if there was a way to get the best of both worlds? Effective stomach care usually requires a phased approach: drugs for the acute phase, and diet for the recovery phase. But now, there is a third path that bridges this gap: Bisbit stomach care and dietang. This is a breakthrough in precise herbal restoration. Compared to pharmaceuticals, its advantage is that it is gentle and systematic. It doesn't rely on harsh antibiotics or acid blockers. Instead, it uses a synergistic blend of herbal extracts like reishi mushroom and poria. It neutralizes discomfort quickly but focuses on the root cause, repairing the mucosal lining and balancing the gut flora, all without the side effects of long-term drug use. And compared to traditional food therapy, its advantage is precision and efficiency. It takes the concept of food as medicine and upgrades it with modern extraction technology. It delivers a concentrated, quantifiable dose of active ingredients specifically targeting mucosal repair and H. pylori suppression. It works much faster than just changing your diet alone. Think of Bisbit stomach care as your specialist for mucosal repair, and the H. pylori Treasure series as your gentle shield against bacteria. This represents a new era of active stomach care. It is perfect for those dealing with chronic stomach discomfort, long-term recovery, or anyone who just wants to prevent issues before they start. You no longer have to choose between suffering through side effects or waiting months for a diet to work. With Bisbit, you can actively protect your health and enjoy your life, and your food, again. Thanks for watching. If you found this helpful, don't forget to like and subscribe for more health insights.